Hello, Ma'am Norma. I am Ray Paring. I am going to discuss the natural and artificial of contraceptives. Oral contraceptives. Contraceptives come in a packets of 21, 28, or 91 tablets to take by mouth once a day, every day or almost every day of a regular cycle to avoid nausea. Take oral contraceptives with food or milk. Take your oral contraceptive at the same time every day. And it does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptom of PMS, premenstrual syndrome. And it can also create your blood pressure. It does not protect you against sexually transmitted infection. Breakthrough bleeding, spotting is common in the first few months of using the pill. It has been linked on an increased risk of some serious health condition such as blood clots and breast cancer. And 2 is transdermal patch. Transdermal patch acts a carrier for a drug, holding it until applied. At the point of application, the patch adhesive secures the skin, and the drugs contained in the patch will begin to permeate into the bloodstream. The patch is not a perfect means of contraception because of some drawbacks listed below. It does not provide protection against sexually transmitted infection. Possible effects: blurred vision and winded pupils may occur as your body adjusts to the medication. Dry mouth, drowsiness, dizziness, decreased sweating, constipation, and also mild itching. Redness on the application site may also occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. And number 3 is vaginal ring. The vaginal ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of hormones, estrogen and progesterone, into a bloodstream to prevent pregnancy. Advantage and disadvantage: it doesn't interrupt sex. It's easy to put out and take out. You don't have to think about it every day or each time you have sex. The ring isn't affected if you sick or have diarrhea. It may help premenstrual symptoms. And you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. It may cause temporary side effects such as increased vaginal discharge, headaches, nausea, brace and tenderness, and mood changes. The ring doesn't protect against STIs. Number 4 is subdermal implants. Subdermal contraceptive implants involve the delivery of steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer. Advantages of progestin implants include long-term and contraceptive action without requiring the user's or provider's attention. Low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. And disadvantages: you may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Many complications have been associated with continuous contraction, including menstrual disturbance, headache, weight gain, acne, dizziness, mood disturbance, lower abdominal pain, hair loss, loss of libido, pain of the important site, neutropathy, and folliculocytes. And number 5 is hormonal injection. The contraceptive injection, Depo-Provera, Sayapres, or Norestat, releases the hormone prostogen into your bloodstream to prevent pregnancy. Advantages and disadvantages of injection. It's an opinion if you can use estrogen-based contraception. You do not have to remember to take a pill every day. It's safe to use while you are breastfeeding. It's not affected by other medicines. Side effects can include weight gain, headaches, mood swing, breast tenderness, and regular bleeding. Your periods may become more regular, heavier, shorter, lighter, or stop. Number 6 is intrauterine device. An IUD is a small T-shaped plastic and copper device put into your womb uterus by a doctor or nurse. It releases copper to stop you getting pregnant and protects against pregnancy for between 5 and 10 years. It's sometimes called a coil or copper coil. Advantages and disadvantages of IUD to protect against pregnancy for 5 or 10 years depending on type 1s. 7. Chemical barriers. Chemical barrier methods are basically spermicides, which come in several forms and are used inside the vagina to stop sperm before it can make its way to the uterus. Advantages of chemical barriers protect against pregnancy. Barrier methods do not use hormones. These methods do not affect a woman's menstrual cycle. Barrier methods can less than hormonal types of birth control. Disadvantages of barrier methods of birth control. These methods do not prevent pregnancy as well as IUDs or hormonal forms of birth control. Barrier methods prevent pregnancy only if you see them every time you have sex. You may have to interrupt sex to use some barrier methods and birth control. Possible effects. The spermicide use of diaphragm can increase the risk of getting HIV from affected partner. Use of the diaphragm and spermicide may cause vaginal burning and irritation from the spermicide. Diaphragm or cup is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix. You need to use it with a gel that kills sperm. Advantages of diaphragm or cup. You only need to use a diaphragm or cup when you want to have sex. Disadvantages of diaphragm or cup. It's not as effective as other types of contraception. And it depends on you remembering to use and using correctly it. Cervical cup. The cervical cup keeps sperm from entering the uterus by covering the cervix. For added protection, spermicide is put into the cup before inserting the cup snugly over the cervix. Advantages and disadvantages. Unlike the diaphragm, the cervical cup protects against pregnancy for 2 days or 48 hours. And for multiple acts of intercourse within time frame, when placed appropriately, the cervical cup is often not felt by either partner during sexual intercourse. Most girls who use the cervical cup have no problems, but possible side effects may include from spermicide, irritation of the vagina and surrounding skin or allergic reaction, strong odors, vaginal discharge if the cup is left in too long. Male condoms. During sex, you wear the condom on your penis to prevent semen and sperm from entering your partner's body when you ejaculate. semen can carry STIs, it also contains sperm. If sperm goes inside a vagina, there's a chance it could meet with an egg and lead to a pregnancy. What are the advantages and disadvantages of male condoms? They are the most effective protection available against STIs. They do not affect future fertility for either a woman or a man. They're used only at the time of sexual intercourse. They are safe to use while woman is breastfeeding. Female condoms. Female condoms are barrier method of contraception worn inside the vagina. They prevent pregnancy by stopping sperm meeting an egg. Advantages and disadvantages of female condoms. Advantages: female condoms help to protect both partners from STIs including HIV when used correctly. They are a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Disadvantages: some couples find that putting in a condom interrupts sex. To get around this, insert in it, advance or try to make doing so a part of foreplay. Female condoms are very strong, but they may split or tear if not used properly. They're not as widely available as male condoms and can be more expensive. Surgical methods. This can be used to evaluate illness and injuries, as well as to obtain tissue samples and make repairs. Laparoscopy, endoscopy, arthroscopy, bronchoscopy, thoracoscopy, cystoscopy, gastroscopy, and hysteroscopy. Advantage: prevention of improvements to medical condition caused by patients, obesity, surge energy, increased life expectancy, and increased self-esteem. Some of the disadvantages of surgical sterilization include the following. It requires surgery, usually under a general anesthetic. There's a risk, albeit low, of surgical complications such as internal bleeding, infection, or damage to other organs. There are three main types of natural methods: the symptoms-based methods, the calendar-based methods, and the breastfeeding of lactational. Amenorrhea method. Symptoms-based methods rely on biological signs of fertility, while calendar-based methods estimate the likelihood of fertility based on the length of past menstrual cycles.